Christy Shearer.
Steve Muskal.
Good having you here.
Nice to be here.
Yeah, I'm curious, when I first reached out and said, hey, do you want to do a podcast? What's the first thing went through your mind?
Why me?
No.
And then wait a second, you're doing a podcast? So yeah. Just why me?
Yeah, well, I mean, there are a lot of reasons why you. We've been neighbors for years and then on again, off again. And you know how it is sometimes the people closest near to you don't know much about.
Yeah.
And that's actually one of the reasons I wanted to do a podcast with you. And the other thing is I tend to be a little too lopsided on male guests, and I wanted to have a female power business industrial titan lady on.
Good for you.
I always think of you in terms of someone who's in the high-powered business world, mainly because you're in a similar world that I'm in. You're on a different side of the spectrum. You're on there's already a drug or a device, and I'm in the early preclinical drug discovery. I want to hear about you and tell me about who Christy Shearer is, how she became Christy Shearer. And
that's heavy. Yeah. I think as it relates to how I got started and my business and all of that, it goes back to when I was 12 years old. I was diagnosed with type 1 diabetes. So I've lived pretty much my entire life with type 1 diabetes.
Wait, I'm sorry, 12?
12.
Don't people get diagnosed earlier?
No. In fact, it's actually 85% of people get diagnosed before the age of 20. So people think of it as a childhood disease, and actually so the juvenile, what was it called? JDRF, Juvenile Diabetes Research Foundation, which has been founded for many, many years, over 50 years. They've just changed their name to Breakthrough Type 1. And the reason for that is because it's no longer a juvenile disease. So patients can get diagnosed with type 1 at a later stage in life.
Sorry about that. You just blown me away. I mean, I can't believe it. Type 1, I thought you just don't really have the ability to produce insulin. Is that right?
That's correct.
And so how do you go throughout almost all your life and not be able to produce insulin?
So you do produce it, but at some point the body starts attacking the beta cells. So the islets of Langerhans, as you know, the insulin beta cells. And so your body just, at some point, there's a mechanism, kind of like cancer, honestly, is that it starts and attacks the good cells. And so that could happen at any time. And there's a lot of theories around why does that start? Just like cancer, why does it start? Nobody knows. In fact, that's part of the reason that there's not a cure for type 1 diabetes right now, is they don't know really the reason for starting, that the body starts to attack itself.
Okay, so that's where I made the wrong conclusion. Just because someone wasn't diagnosed until, say, age 50, that doesn't mean they live 50 years with lack of ability. It was only more recently up to that point of being diagnosed.
Exactly.
I see, okay.
So your body starts attacking. So for me, my body probably started attacking all the beta cells around 11 years old. And then at some point at 12, they also have a honeymoon period when you actually get diagnosed with diabetes. And then over time, it just starts lessening and lessening until you're completely 100% dependent on subcutaneous insulin.
Okay. I didn't mean to interrupt, but I just, whenever there's like a scientific factoid that I just knew to be, I want to hear about it. But so you're 12 years old, you get diagnosed, then what happened?
And I basically go into, I think I was in the 8th grade and got diagnosed, which is very, very different than today. So when you're diagnosed with type 1 diabetes at the time, you go into the hospital for about a week. I was probably pretty close to death at that point because my blood sugar was, I want to say, over 1,000. I was wasting away. I mean, I was just skin and bones by the time. It was very classic type 1 diabetes diagnosis. And just, so I went into the hospital and then started living my life just as a kid. And I don't really know, and I don't know that my family made a big deal out of it. I didn't make a big deal out of it, but now I'm just living with diabetes, injecting insulin every single day. At that point, which is going to bring me to why I'm in the business that I'm in, we were still doing urine testing. And so the fact that people were checking what a glucose was through urine is just so unbelievable. But we were doing that at that time. And then I remember probably at 18 years old, there was something called a blood glucose monitor. that you could get a blood glucose within 2 minutes. And my mom and I I grew up in the South Bay, and my mom and I drove up to Van Nuys, California to get this nurse to teach us how I was going to stick my finger and get a blood glucose.
Yeah.
And so it was a crazy time, but I remember thinking at that time, and I was probably not 18, I was probably 15. And I remember from that time when this nurse sat down and talked to me about diabetes and that I was going to be doing this blood glucose test, that I thought, this is what I want to do with my life. I want to be this nurse talking to children with diabetes. And I never forgot it. Am I being recorded?
No, now we're back on. But I have so many questions about that, but I don't want to interrupt your story. I mean, it's awesome. So your passion of a career started really at a young age.
Very early.
And so you've been directed ever since that time.
So I don't know if I knew I was directed, and actually my pathway, so I went to college. So I went to Cal Poly. I was in the School of Biology. I majored in food science and nutrition because I thought I was going to be a registered dietitian, because then I got to speak to kids with diabetes is what I really thought. Yeah.
Because type 2, the demographics have changed because it's hugely related to lifestyle, and it's a total different disease, and some would argue, I believe so, somewhat reversible, type 2, with lifestyle and dietary changes. Type 1, however, is lifelong chronic. There's no reversal on that. Is that right?
Right.
Yeah.
So once you lose all beta cell function of your pancreas, secreting insulin, you are reliant, life and death, that you are able to inject insulin.
Yeah, that's interesting. Yeah, and I'll get back to your food science and how you might have tactically changed, but I just want to throw it out there, just seed your mind, because we live in the pharma space, and pharma typically likes not to cure people from a business perspective, right? They love chronic illnesses that they keep selling drugs and devices to. So type 1 diabetes is just like the king of chronic diseases to these folks, because it can start very early on in life, right? Did you have a sense in college that were the case?
I mean, I don't know if I knew it at the time and haven't really even thought about it, but I will tell you, people with diabetes, type 1 and type 2, will spend 2/3 over the amount of a normal person or regular non-diabetic at the retail pharmacy. So our cost to manage our disease is almost what is that? 3 times the amount of just a regular person. Any other disease, heart disease, all of it. So we're kind of the cash cow. If you walk into CVS, we're going to spend so much more money. And that's why with diabetes, the money piece is a big deal.
Yeah. And so sorry, I'm not interrupting your story, but I got to throw it out here. So because type 1 can't produce insulin, or maybe not a full quantity of insulin, maybe there's small amounts, but the real challenge is that blood sugar will spike with meals in different situations like hot, cold, exercise, things like that. But I'm wondering, is there any strategy that type 1 folks can play to sort of artificially non-insulin based strategies to control their blood sugar levels?
I think so. I mean, I think that's a very philosophical conversation as far as what can you do, because obviously if you decrease your carb amounts and you increase your exercise, decrease your stress and all of that, there's so many factors. But you said they could secrete some insulin. That's just not true. No beta function whatsoever.
So it drops off to zero very quickly?
They could take out your pancreas and it wouldn't make any difference to you, except for all the other stuff that goes along with that. But you have zero function. So with type 2s, the problem with type 2s is you have a lot of insulin. There's enough insulin. It's just that the receptors no longer work. So if you think about insulin just think of the cells, right? And you need a lock to get into the cell. Insulin is the key. Type 2, you have bad locks. It's not that you don't have the locks. Your locks are bad. Gotcha. So you can't open the cell to get all the nutrients and everything in, right? But with type 1, we don't have bad locks. We just have no keys.
Yeah, got it.
It is I hate that they're called the same thing because they're, you just talk about insulin and all that, but they're very different. But with type 1, sure, there's strategies and people talk about that. Oh, I can cure your type 1. I discount that completely. Yeah. However, there are drugs that are now delaying the onset of type 1 diabetes because they're starting to be able to identify markers. So I didn't want this to be all about diabetes, but we started here.
That's okay.
There's a lot of good stuff that's coming out from different drugs that are now available and just coming to market that will delay the onset of type 1 diabetes.
That's hugely interesting. Knowing, see, it sounded like there was a hard drop off, but maybe there's a slow decay. That's maybe a short period of time, but slow decay.
There's definitely a slow decay.
And so that's why you can pick up with some markers that there's soon to be type 1. And so is that a standard blood test people take or can take?
So it is a blood test. And it's not necessarily, I think, just a regular blood test. I'm not exactly sure of how they're doing the testing, but I know they're trying to get all endocrinology and primary care. Yeah. If you have a sibling, a parent that has type 1 diabetes, they're encouraging you now, like, just get tested so that we can look at the markers. Because now, before they were doing a lot of tests, there's a DCCT trial in 2001, I believe, that looked at, like, if you may develop diabetes, but there was nothing to do about it. Why would you ever put your children through that? Tom and I have 2 kids with 2 type 1 diabetics in the family. We would never put our children through that because there was nothing that could be a preventative. Now in 2025, I think it came out in 2023, there is something that will delay the onset. And so people should be tested for it. This is not a PSA, by the way.
But, but that pharma often works that way, where you need to have a diagnostic first because they need it in early research anyway. But they surely need a drug to follow up soon. And if they didn't have it at the time, I totally get that.
Yeah,
so.
It took them 25 years to come up with something, right? So
yeah. Well, okay, let's go. I'm sorry. Let's go back to your food science. That's you kind of triggered my thinking that way. You're in food science. You're wrapping up, or tell me what happens next.
Yeah, so I am in college, and I think that I'm going to go down this registered dietitian path so that I could help people with diabetes. And I spent a short part of an internship in a hospital, and I said, I'm never, ever going to spend 12 hours a day in a hospital. It was not my personality. Yeah. And so I thought, how else can I do this? And so I interviewed with a company that sold everything from sugar-free candy to insulin pumps and everything in between. And so I came to the president and I said, I would like to be a diabetes educator for your kids that come into your store, because when I was 15 years old, I met Nurse Betty and she taught me how to use this, and I want to do exactly that. And he basically laughed at me and he said, that's not a job. Nowadays it's a job, but back then it was not a job. And so from that, he said, you know what? Why don't you go back? I said, I have summer school to be able to graduate from college. And he said, why don't you go back? But I'm going to offer you a job. And so at that point we came in, he's like, I'm going to tell you, you're going to probably sell diabetes. I said, okay. So it was not something that I even thought I would do. I thought I was going to be this nurse type of person. And I ended up being a salesperson for the services that this anomaly pharmacy was part of.
So the funny thing is, pharma sales reps actually do educate doctors. So in many respects, so you actually were an educator. You're just teaching to some really high level, often pains in the asses students who are actually sometimes worse than kindergarten. But they're all on the spectrum, so they're all fidgety and not looking at you anyway, right? So it's the same thing. That's really cool. So you got that was a minor pivot, but you did it, and then.
Well, with my personality, honestly, like, just talk about something falling into your lap, is I wanted to be able to combine my clinical brain with my personality, which is 100% sales. And you don't go through college thinking you're going to be a salesperson of any type. That's just not the dream. And so I always thought I had to have a vocation to graduate from school. And so that's why I picked biology, thinking I was going to be this registered dietitian. But when you learn very quickly that I would have failed in any kind of clinical setting, my empathy gene is very low. So being a salesperson, still being able to use a biology background and my knowledge about diabetes was just my golden ticket to catapult from. And that's actually how I got started into everything. And it was actually the company that I worked for and met my husband in was called the Sugar Free Center, which is now a huge conglomerate of a diabetes market. Talk about how things change.
Yeah.
But it started in a garage and it was called the Sugar Free Center. And it became a very successful business for sure.
It's interesting when you say you didn't think you'd see yourself as a salesperson. CEOs, actually some of the most successful people on the planet, have to be hugely salesy, a salesperson, right? And the most wealthy person is this autistic guy on ketamine, right? But he's still a sales guy. And so I don't think it's demeaning in any way. I remember my first business card had marketing on it and I felt disgusted by it, but that was because I was coming out of grad school. But at the end of the day, that's just such an important skill set.
Yeah. I'm going to tell you, every person in this world is a salesperson.
Yeah.
Whether you're selling to your children, selling an idea to a coworker where you have, everybody's a salesperson at one time.
So you had that job, you pivoted. Then you started to get into like real high powered sales, right? I mean, did your big pharma entry happen right thereafter?
So I was at the Sugar Free Center where I got to tell you, I probably made the biggest impact in people's lives at that job because I was going straight to the patients and I was walking into clinics in East LA teaching patients how to test their blood sugar. And I remember back then, that was a new technology that gave people in 2 minutes, now it's 5 seconds, but in 2 minutes, it gave patients what their blood sugar was, kind of a real-time blood sugar. And that made a huge impact in people's lives. And I was in a very high Medi-Cal densely population, partly because that's where this company could make money. And I could see that if I catered to this population, not only could I help, but I could make a ton of money doing it because of how we were incentivized at this company. So I did that for 4 years.
But that was still the urine tasting technology, right? It was urine.
No,
you did finger sticks at that point?
It was doing blood glucose.
Okay, yeah, because that's much more precise. There's no way a sweetness test could take 2 minutes. I would think it'd be very quick.
And from that job is what landed me at J&J, selling for a company that J&J owned called LifeScan. And that was one of the largest blood glucose meter companies in the world back then. After 4 years of being at the Sugar Free Center, I got recruited by J&J and spent the next 12 years there where I was building my career.
Yeah, J&J, let's see, when did we meet? It was in early 2000s, right? You were at J&J then, weren't you?
I was,
Yeah.
Yep.
Because I remember you with your high-powered suits, and you'd be traveling nonstop, and and J&J's been a client of mine for years at that time too. So I had great respect, and I see pharma in a whole different light now. There's a new book, as you might have I mentioned. There's No More Tears that doesn't paint a great picture for J&J.
Yeah.
But you were inside of the business that initially was a device because of scan.
It was device, yes, because it was a meter. So
Right.
It was a physical thing, we weren't pharma back then, which is a big distinction between medical device and pharmaceutical, because I've been in medical device most of my career. And it's not till this last 2.5 years at my current company that I've been in actually pharmaceutical. So I would consider myself more of a device person than a pharma girl.
And I bet you, big picture, devices tend not to do harm the way that drugs do. So you have not left behind in your wake a ton of people who've just been devastated because of a drug. Right.
And honestly, being in the diabetes, even in my current company, who is a pharma company, I mean, we sell insulin.
Yeah.
And so there's do no harm with insulin. And our insulin is incredibly different because it's inhaled. And we can talk about that.
Yeah,
but
that's cool.
Yeah, so it's a really cool drug. But you're right. I mean, device is a little more benign, especially with what we were doing with insulin pumps and continuous glucose monitoring and blood glucose meters at the time.
Yeah, I mean, I know you're aware, not many people necessarily know this, but to get approved for a device is much more rapid than a drug. But any kind of hardware, software iteration is still pretty slow. So I imagine you're used to product cycles that are still not really fast, but by much faster than drug cycles.
Yes.
Yeah.
Yep.
And so when you hear feature requests, so to speak, it might take a year or 2 or 3 to get into your device, or maybe more, but it's not 20 years.
Right. Agree.
Yeah, and so that's helpful. But because sales folks in other spaces, they often get beaten up by their customers because we've got this problem with that and this, and
Yep.
patients are dying.
Everybody
That's even worse.
has ideas of how we could have made a better mousetrap.
Yeah.
It's amazing out there.
Yeah. That's pretty cool. I didn't know you were an inhaled. So that's wonderful, because, I mean, sticking is a pain in the ass, so to speak, right?
Yeah. And honestly, so inhaled insulin is an amazing thing. So it's been 10 years that inhaled insulin has been out there. Very few people know about it. It's just mealtime insulin. So when you're type 1, you have to have a basal insulin and a mealtime insulin, right? So basal will just kind of keep you at an even keel, and mealtime you need for any kind of carbohydrate that you're eating. So you're pretty much sticking yourself, if you're not on an insulin pump, 3 to 6 times a day for every time you eat. And so inhaling your insulin where you're not having to inject it is one thing. So that's a big thing. However, our insulin is incredibly fast because it uses the lungs, which is a great mechanism to get medicine in the body.
Oh, so it's literally like an inhaler, like asthmatics use?
It's an inhaler, way better than an asthmatic. So it's very, very, very
precise. Powers it in?
It's a powder. So it's a human powder insulin that you inhale through just an inhaler, and it gets in the body in a minute, and it starts acting in 12 minutes, which is about 10 times faster than just any kind of rapid acting insulin, whether you're taking it injected or through an insulin pump. So it's powder. So it's human powder insulin. It's in a monomeric form.
Okay.
So not to get too technical, but it's mono. So it's not a hexamer. So any kind of subcutaneous insulin that you have to inject is a hexamer.
Okay.
Right. So that means it has to be broken down into the body. So it takes a long time for like the peak action profile to hit. So your food is typically in a normal, healthy pancreas, your food's hitting at 45 minutes, right, in everybody. Whereas injectable insulin is typically not peaking for 90 minutes. So you can just imagine if you're a type 1 diabetic taking injected insulin, you're constantly chasing your highs for mealtime. Whereas if you have a rapid-acting inhaled insulin or ultra-rapid-acting inhaled insulin, it's kind of mimicking natural physiology of how your body works. So it's just a really fast absorption of insulin. And so you don't have these kind of a big roller coaster, a much smaller, smoother roller coaster.
Well, certainly if it has to be processed and that it's broken down to the monomer form. But is it just lyophilized down and it's just crystalline, or is there some sort of binding agent? The reason I'm asking is there any kind of like long-term issue, not coal miner's lung issue, but just long-term issue that people should worry about?
So we've been studying it for 20 years.
Okay.
It's been on the market for 10 years, and we continue to do lung safety tests. We ask patients to do like an FEV1, which is not a pulmonary function test.
Okay.
One is just a straight spirometry, which is a 20-second blow into it, and we don't even ask for a magic number. We just ask for a baseline. So there is we want to make sure that your baseline is not going down, decreasing more than 20%, but we decrease just like an aging lung function. Yeah. So that's probably when you sell our drug, the number one thing is people aren't used to it, right? Insulin's been around, injected insulin's been around for 100 years. Inhaled insulin's been around for 10. So we think it's a long time, but it's in its infancy stage. Yeah. But the thing with it is that we just continue to test lung function, and we don't see anything, and we're about to go into the pediatric market. So you and I both know the FDA is not going to improve any drug and put it into children that's not safe. Yeah. So that's where we are right now with the current company.
The big picture is between our air quality and the fact that youth is vaping left and right, and all that is worse for lung capacity, controlled pharmaceutical agent, which is actually based principally on what we produce naturally anyway, and just better form, ready to go form.
And the lungs, so they're a tennis court wide of like all of that. So the lungs are a great mechanism to get medicine in the body. The nice thing about the inhaled insulin is it doesn't stay in the lungs like nicotine would, right? So it's in and out. really quickly. And that's why they're not seeing any decline in lung function, because it's not sitting in the lungs at any level.
Yeah.
Vaping,
Nice.
smoking, all of that. So if you have COPD or asthma, you're probably not going to want to use inhaled insulin, right?
Yeah.
So just be logical about it. It's not something that sits in the lungs. So, and I honestly think if more medications were delivered through the lung, we'd have better outcomes.
So this is why I wanted to throw a curveball at you that I thought maybe you could still produce insulin without a pancreas. Does insulin pass the blood-brain barrier? It's a tough question. I wonder if the brain produces insulin.
In my mind, the brain only survives off glucose and oxygen.
Yeah.
I don't know anything about insulin in the
Yeah, I
brain.
wonder if the brain could, it's got to protect itself from excess glucose
Yeah.
too. So it's a research subject that I will look into. I'm just curious.
Yeah.
That's why I kind of in the back of my mind thought, well, maybe there's an opportunity for your body to produce small quantities of insulin that's not necessarily just in your pancreas. But again, that's a side topic.
I don't know that you're the PhD. You
Yeah,
would
I should
more
know
than me.
that stuff. No, I mean, let's, you know what they say, mile high or mile wide, whatever. Mile deep and micron thin, something
Right.
like that. But yeah, anyway, so don't need to go.
Sorry, I hope I didn't take you off on a tangent
No,
with
I
all of
love-
that, but it's
I
fascinating to me
totally
as well.
love it. No, it's huge. Tell me a little bit about working in big pharma in a sales capacity and in a world where you're selling typically to a male-dominated world, right? Because aren't most physicians historically male?
So it's probably predominantly male. However, I would say there's so many more females, so you cannot make that assumption any longer. I
Right.
think the longer we live, the more females will go into that. I would say when I entered my career, almost every big boss was male, and I don't find that to always be the case now. I'm a huge advocate for getting women into leadership positions. If we do not have diversity of thought between men and women in a company, I feel like the company is so much weaker. We bring so many different things. I don't think it should be all female either.
Yeah.
I mean, I just think that diversity of thought is so critical when you're building any kind of company and strategy.
Yeah, I totally agree. My first real boss outside of graduate school was a female, actually second technically, but the best boss I ever had. She taught me so much. And I think she was softer on her male subordinates than she was on her female subordinates. I mean, I think she was pretty harsh on the females. The female seems to be there's something there. Maybe it's just like kind of the samurai sword thing. Women try to fold it to women want to make their subordinates even stronger. I don't know what it is, but have you sensed that? Do you have more people who work for you that are male or female?
Female.
Yeah.
Yeah.
And it works well.
So I have a team of 10 currently, and there's 7 female and 3 male. I think it's interesting, and especially over time, I think I fought like hell to be a woman, because when I came into J&J, there were 10 leaders at that time, and I was one of 3 women, maybe even 2, and then 1 came on. So it was mostly a male-dominated. I got promoted into another position where it was all male for a while, and just I was the only female. And so we have this little chip on our shoulder that we always are going to fight a little harder to prove ourselves, which shouldn't be the case, right? I would say even now, sometimes it's just like I get mansplained to many times in business.
Yeah.
I get talked over still in business, and being with a physician many times, if I'm a male or as a female talking to a male, I'm taken less seriously.
Ouch.
And so it's still a thing out there.
I'm kind of curious how you became such a stands with a fist person within the male business world, because I think there are a lot of women out there, younger women, even middle age and older, who are maybe looking for career changes. They might still feel this male dominant thing coming at them. And what did you do? What about Christy Shearer made her, or whatever your maiden name was before, made you who you were in terms of like, look, I am woman. Don't talk to me like a woman. Talk to me like a person.
Right.
Or as a person.
I always knew my worth. I didn't know my worth in college because I wasn't good at college. But the minute I got out into my first career, I knew I was good and I knew what I was talking about. Partly because I chose a field that I knew a lot about, right? Living with diabetes most of your life. So I picked something that I knew about, and I picked something that I was passionate about. So I think the first and foremost, I came in knowledgeable, and then I just grew that knowledge. So I think women coming in today is like, just know your power, first of all, understand that. I've never questioned my power. I just knew from the very beginning that I know what I'm talking about. I don't care if you're man or woman who I was talking to. It's just how I've grown up. I grew up with a single mom. My dad was killed when I was very young. So at 9 years old, I lost my dad. And I watched a homemaker put herself back through college. She went into art design, which I didn't understand that, but then ended up buying an art gallery and framing. And I watched this woman from the time that I was 9 years old just kind of pick up, from where my dad was dead, has 2 girls to raise, and took off from there. And she has the strongest work ethic and just knew what she wanted and what she had to do with nobody telling her. So I watched this woman as a great role model to what I wanted to be. And so I just never really second guessed myself in the very beginning.
Yeah, so sort of you had it in your genes, but there's a nurture element. That's actually a pretty profound statement because it's true, right? 'Cause it's genetic largely, right? The type 1 situation, or perhaps an autoimmune that's acquired. I don't know, because to your knowledge, are there other type 1 dual parents that don't have type 1 offspring? Because you said both your daughters aren't type 1.
Right. So it's interesting because in the beginning, Tom and I tried to find other couples that were married to type 1s.
Yeah.
And we were told by physicians that, look, if you're short and your husband's short, too bad, your kids are going to be short. And we just haven't, had that be the case.
Right.
Doesn't mean that the kids don't have some kind of endocrine problem,
Yeah.
because both of them may. So it's just that part we may have passed down bad
Yeah.
genes. But it's interesting. There's not a lot. To this day, I have not met another 2 type 1 couples, which is really interesting because you would think just a lot of type 1 people that living with type 1 diabetes go into the field of diabetes. So they either become a diabetes educator, they become an endocrinologist, they get into sales. But like my company alone, we probably have 13 people with type 1 diabetes. Type 1 is a very rare disease. People hear about diabetes all the time because of type 2. I think it's now up to 1.5 million people with type 1 diabetes in the U.S. That's a rare disease.
Yeah. Yeah, and so I'm sure there's been a ton of work in the genetics of it, but look, even current medical science doesn't know so much. It's crazy that gene expression could be mediated by stress factors 3 or 4 or 5 generations prior to you, right?
Yeah.
Or it could be stress during gestation. It could be environmental activation, deactivation. There's a ton of stuff that just no one really knows, right?
Right.
Biology is amazing and how it can self-correct, but unfortunately with this area, it just hasn't been able to self-correct yet. Hopefully there'll be a way to
Right.
stimulate it. We can.
There are theories that it starts with a flu or a cold or a stressor. Tom's parents divorced when he was 3 years old. And 3 years later, he developed type 1 diabetes. So he's had type 1 diabetes since he was 6 years old.
And your dad passed when
And
about
then-
2 or 3 years before you.
So I was 9 when my
Yeah.
dad passed.
Yeah.
3 years later, I developed type 1 diabetes. So
Yeah.
I always just think there's a conspiracy with 3 years and developing, but they do think there's something, whether it's a sickness or some kind of environmental stressor that happens that starts the body to attacking its
Yeah.
good beta cells. So
Yeah.
it's interesting, because people don't know, right? They don't understand why the body starts doing what it's doing to attack all the beta cells.
Yeah, you might have had more susceptible gene basis. Nature loads a gun, we often pull the trigger, right?
Mhm.
And so a lot of people worry about, oh, what's in my genes? The reality is a huge percentage of what we are and what we become is a result of what we experience from human interaction perspective, virus, pathogens, air, food, lack or over-exercise. All that stuff is just the stimulus that's just a massive percentage of gene expression.
Yeah.
So it's just a side note. But Yeah, I didn't mean to get two sides nerdy at you, but this is cool stuff. I again, I just didn't know what your world was, and we lived, you know, literally down the street for years, right?
Hmm.
And I'd see you at parties all the time. I mean, from the man-woman thing, I know you hung more with the dudes than you did with the women a lot of times. Is that just because you're just more comfortable over your career, or is it just because all the women were elsewhere?
I think it was, I related to the men in our neighborhood in particular, as I was one of the few working women.
Yeah.
And I just related to men. I dealt with men in business and all of that. And I feel like I had maybe more in common. I loved all the women in the group and got so much from them. But I think if we're at a party and we were talking, I think my interest level was what you all were talking about. So I just, and I probably have always been like that on some level, that there was a level of comfort just talking business and not talking, you know, the other stuff, the soft skills. I'm working now as I get older more on my soft skills
Well,
than my business skills.
You know what's really funny about that is I've always enjoyed spending more time with women than men. Men bore me in social settings. I've never been that frat boy bro kind of thing. It's just like it's boring to me, and women are such more interesting. But I've seen that you've done a lot more interaction over the years. You're in a bunch of book clubs and stuff, right?
Mhm.
I actually see you around groups of women more now than I think I'd seen in the past.
I mean, honestly, I don't really care if you're a man or a woman.
Yeah.
Interesting is interesting to me.
Yeah.
If you have a story, I want to hear about it. I'm incredibly curious, which at this point I would say to anybody that wants to get in sales, if you don't have an innate curiosity, don't go into sales, because you will probably not make it. But I have had idle curiosity to the point where I'll have a dinner with a couple and Tom will be like, "Did you have to interrogate them the entire time?" I am just a question person, and it just comes from, that is like who I am. I just have this pure curiosity. So at the end of the day, I don't care if you're a man or a woman. I find fascinating men and fascinating women.
I mean to kind of single that out. I mean, I totally know that about you, not just the interrogation part, but when you first came in and I was trying to set things up, you were hammering me with all these questions. And I can generally multitask. Some of your questions took serious thought. So I was like, man, I mistyped my password like 8 times. It's like,
That's funny.
yeah, but it's like, chill for a second, Tom. Don't stop interrogating me. I want to answer your questions. They're great ones.
I do honestly have to explain to people, especially new employees, I have to tell them, look, I'm going to ask you a ton of questions. You don't have to answer them all. I will judge you if you don't answer them, but I just want to get to the root of everything. Because honestly, if you manage salespeople, you really have to understand why they do what they do and what motivates them. Otherwise, you'll never, I can't be their inspiration, but I certainly can try to help motivate people, because what they do affects my life, my financial life tremendously, right? So I'm constantly in that mode of trying to figure out like what makes you tick, what looks like success to you, so that I can help you get there.
Yeah, it's funny. When I was looking through LinkedIn, as I mentioned, it's your background prior to this discussion. I had a message to you. I think you must have changed jobs, or I got an alert in LinkedIn. I was an early LinkedIn adopter, so I just got a ton of alerts on. And I messaged you because I think you were hiring, and I think I said something like, "Would you hire me?" And you're like, I was the CEO for 20 years, right? So I didn't need a job. But you're like, "Do you really want to work for me?" Do you remember that?
I don't remember that.
Maybe I paraphrased, but that's effectively what it was. And I don't think I even responded. I don't think they had emojis or ha-has or anything like that.
Right.
I didn't respond.
That is funny.
Yeah, because, I mean, some people have gone through their same career for their entire lives. I mean, a huge percentage of my career has been my company. You've spent, I was like, what, 10 or 11 years at J&J, another 10 or 11 years at Roche? I mean,
Yes.
decades at pharma companies, and that's,
Yeah.
it's kind of rare, actually.
So both of those are device. Yeah. So, I mean, and this is what I tell people is like, I've been doing diabetes for 30 years, right? Even though I've been going to different companies, I basically have had the same job, because, whether I lead a team at Roche or J&J, I've been at Nova Biomedical, BD, a lot of different companies, but I basically been doing the same job. So regardless of that, I just am a one-trick pony for sure.
Well, look, the most successful people are, and you obviously had this passion from the beginning, and you knew it better than anyone else because you, type 1, right? And
Hmm.
so the passion is such a critical starting point, and the curiosity is a critical element as well. Some people have passion but don't have the curiosity, but you also, generally have the grit to keep driving on, and that's demonstrated by staying in the same company for multiple years. So
Hmm.
it's a great combination, and I mean, to the man and woman thing, I should say I don't look at men versus women that way. I look at people, and it just so happens that if I then later look at it, women just statistically are more interested. But I don't
Right.
necessarily seek out the women. I seek out the conversation and the stories, right? And think about sales. It's all about storytelling
Hmm.
and communication and helping each side meet,
Yeah.
somewhat in the middle, but so they benefit from the interaction. And so if you were to actually offer advice to the young folk today, and it's such a weird world right now, right?
Mm.
I mean, knowing what you know and your various successes and failures, but what would be your primary advice point? I'm hearing beeps. I'm glad camera doesn't go out. But what would be your primary piece of advice to just inspire the youth towards a career or direction?
Yeah. I think that's such a big question because I get people that call me and say, "Can you help me tell me the different steps that I need to get into pharmaceutical sales or device sales?" And I always tell them is like, "Why are you going into it? Is it money? Is it, that you've heard something? Is it because a parent's been in there?" I always want to understand, like, what's your motivation of trying to break into any kind of industry? Because I do feel like there has to be a reason. Like, if you understand why you're going in, understand why it is. And most people have a connection of why they go in. Everybody that I interview for a position, I say, you can go into any sales position. Why Mankind? Mankind is the company I
Yeah.
currently work for. And I say, what intrigues you about this company? And if they don't have a good story to tell around they're passionate about something, I pretty much am probably not going to hire you. The one
Yeah.
thing I would say is, so know why you're going into a company you're going into, and then know all about the company that you go into. Nothing drives me more crazy is that if you're interviewing with me and you have not researched the
Yeah.
company and researched me and researched other people, like today, like, data is rich, right? So we have so much information that we can grab onto. And if you have not done your homework, understand why you're going into whatever you're going into. I would say do your research on that and know everything that you can. Nobody expects you to be an expert on the product or an expert on the drug, but we do expect you to be somewhat knowledgeable about what the drug does, what it sells, and all that. So do your research and then come in with confidence. Come in with like, what do you bring to the company? I ask people all the time is like, what are you going to do differently? I have a team of high performing people. Tell me what you're going to do differently for me, right? How are you going to fill my gaps? Here are a few of my gaps. Tell me how you fill them. So I would just say, like, know your stuff.
Yeah.
Be a badass.
Yeah, everyone's an imposter on their first job. Actually, imposters even on their second, third, fourth jobs, unless it's the same job over and over and over again with just a different company label. Because you don't train for this stuff in college and even trade schools a lot of times. You have to learn how the company does it, and you're always having to learn. So just demonstrating the rapid capacity to learn involves preparation. I'm kind of curious if someone who's not sure what they want to do. I mean, you suffer from the luxury of having known what you wanted to do in your preteens, but some people just don't know what they want to do. Well, do you have any recommendations for them?
God, that's really putting me on the spot. I'm not that deep. I told you I was a one trick pony, so it came very
Giddy up.
easily for me. Like, honestly, so it sounds so stupid, and you're not going to love this answer either, but
That's right.
I think you got to like spend time with yourself writing down, like, when I'm the happiest, what does that look like? Right. So, and just jot a bunch of things down. I have the most fun when I'm doing this, and I hate when I'm doing this. And I honestly just did this with myself recently, as old as I am and as long in my career that I am. And I honestly love what I do. So I can't imagine that I would have done anything differently. But I got to tell you, nowadays, it is not about just the hardcore business stuff anymore, right? People, especially as we go into the younger generations coming up is they want to be happy. They want to find joy and all of that. And it sounds sometimes silly, but I would say, like, if you cannot create a list of what makes you happy, like when I'm doing whatever it is, I mean, it could be dumb stuff. I'm happy doing that. And then educate yourself if there's something that you can monetize from that. I do feel like that's a piece of it, right? Because I mean, you're going to college for something. You had to start somewhere, right? So whatever you're in, and if it's a degree like communication or marketing or whatever, there's some desire that you had to select that.
That's sage advice. That's a great answer. I think more and more people should do that self-reflection.
That's a good word for it. I couldn't come up with self-reflection.
Yeah.
So yeah, that's a great word.
It's easy to summarize in some cases, but I always find it's easier to edit than it is to create from scratch.
Mm-hmm.
Right. So it's easy to pick up on what someone said and make a change to it, as opposed to here's your blank canvas and I threw the blank canvas at you. And you didn't know what I'd be asking you today. So, interviewing well. But see, you do that. I'm not interviewing you. You interview people a lot because salespeople churn a lot. Right.
Mm-hmm.
So you're used to seeing a bunch.
Well, I mean, yeah, I've had some really good hires and really bad hires. And we always say, like, hiring is probably the most important thing you'll do in any company.
Yeah.
You have the right hire in front of you, your job's over. If you have the right, wrong hire in front of you, your job just began. So I try to do that. And it is funny because the bullshit meter is definitely a real thing. Because now with AI, I have had people interview using AI, and that's such a turnoff. And you could be the best person out there, but if you do that, you will not get the job. In fact, shout out PSA, do not do AI interviewing because that person on the other end will know that you're doing it.
They're Zooming you and they're
now
typing
we're way
shit.
off.
No.
So they pick up on everything that the interviewer is saying, and then they create an answer based on, so you can feed it like what company you're interviewing for and what they do and all of that. So you feed it in before the interview starts.
Oh, before, not during. I thought it was during. They're like ChatGPT or something.
No. They do that. And then the interview starts and it's all real time. So my question goes to the interviewee, and in real time, AI gives them an answer that they're then reading to me over Zoom.
That's crazy.
It is so awkward. And I've had it done twice to me. And in the beginning, because I hadn't heard that you could do that, I didn't even know it was a thing. And then another candidate actually had made fun of something about AI interviewing. He's like, I would never I'm like, wait, tell me about this.
Yeah.
He told me about it, and then I was doing this interview.
You're hired.
You're hired just because you gave me information. He wasn't hired, by the way.
Right.
But this person that did it, it was so awkward and obvious. And I just said, this person's never going to get this job. And I can't imagine any hiring manager that's honestly over the age of 40. It was just, but it's a thing. And I heard that kids are using it now because they can give the exact answer that the interview is looking for.
I'm kind of your rare example since I've been in AI for 40 years or whatever. It's so context prompt specific. And I would argue that one of the reasons it's such garbage in terms of response is that the questions are kind of just template, boilerplate, and there's not much background context. I use Claude a lot because you can throw documents and a ton of stuff about yourself because you want it to be able to speak in your voice. And I mean, the prompt itself must have been 5 pages long. It was almost like I wrote the proposal and I said, now put this in my voice. And that's way different than saying, tell me about yourself, or whatever a standard question is. And, if you have this particular problem, how would you solve it? Like a standard interview question kind of thing is going to give a garbage result.
Right.
I think I mentioned this analogy to you earlier. I liken AI like the $6 Million Man. The Steve Austin, if you remember this, was the bionic man. $6 Million Man had 2 bionic legs, a bionic arm, and bionic eye. And I think his girlfriend, Jamie, she was a tennis player. She had other bionic pieces in her ear. She didn't do as well, right? You need to be an astronaut.
Right.
You can't be a tennis player,
Right.
To leverage this stuff. I think as kids train towards AI, I think it's best to still be very expert and not over-reliant, but you just set enough context, enough serious, detailed prompt that you leverage the result, but don't rely on it to speak on your behalf.
Right. Because honestly, especially in sales, there's no interview question that you can answer that's going to tell me how you're going to wake up in the morning and back out of your driveway, right? In sales, it's a very different beast because you're not walking into an office where everyone sees you every day. I mean, nowadays that's the norm, working from home, but I don't know. I can't even imagine what AI could ever say that would have been able to beat what that girl could have told me.
Well, first of all, if someone shows up and they're type 1, you pretty much know they passed a huge number of tests because they've lived this and they're going to have a level of passion, right?
Mm-hmm.
Well, how many of your reps are type 1?
Honestly, just so one.
Wow.
I used to have 2 and 3 with me, but just right now I have 1.
Yeah.
But in our company, so we're a small company of salespeople with 100, and there's 13 people with type 1 diabetes.
Yeah, one of the big challenges in any business is the thought leaders or the founders, you almost want to clone yourself. It's a big challenge because you want people to perform the same way that you do and maybe fill in the holes that you can't. But that's why I do AI, because I try to create forms of content every day so I can train AI, so I can leverage it for my world. So in my world, I've told people this, in my entire career, I've probably written 3 million lines of code in 30 years.
Wow.
And in the last 4 or 5 months, I've written 5 million lines of code.
Dang.
And I use whatever language guys can provide, which unfortunately is Python, but I use the English language. And I describe what I want, and I set context, and it's so enabling. I actually get excited about it every day. Like I wake up in the morning like, oh, what can I create today?
Right.
And so it's tapped into my passion. And so that's kind of my advice, since I asked you the question, to people: tap in your passion, because you have to wake up every morning and want to do it. And it could be a Saturday or Sunday. I heard the other day a guy saying, oh, I'm so glad it's Friday. I'm like, what are Fridays? What does that mean? So are you the same way? I mean, you've been doing your job, your career for your whole career, right? And do you see yourself continuing almost indefinitely because you enjoy it?
I do. I see myself in, yes. And after 30 years, I'm starting to ask the question because I'm starting to hear friends of mine that are retiring and doing things, which I don't. In fact, I made a joke about it at the last book club. And I said, what is this retiring thing that you people speak of? Because financially, I don't know that we're there. I can't even imagine. But also, I just don't want to be at that point. However, I say that and I love my job, but I absolutely want to have a creative outlet. I'm incredibly creative in my home stuff and all of that. And I'm like, can I just do this as a side hustle to get that little creative piece of me out? Because I do see that I'm changing as I get older. People view you differently, especially women in business. They're not viewing me the same as they did one time. I mean, I'm still well respected. I still know what I know, but I can see it coming at a day where I might not be in the same role and I will have to go do something else. And so why not start now to create something else? And I want to use that same thing I just said to the younger generation of like, how can I get a job? I'm doing the same exact thing for myself. Is what makes me happy. What could I monetize? What can I do? But I've been very fortunate in my life to get to do something that never feels like a job to me.
Yeah,
and it's such a cliche. They say, like if you love what you do, you're never going to work a day in your life. And I do believe that because that's where I am. But I'm at this point in my life too, where I'm like, I've been doing the science stuff and the sales stuff for a long time. And I would like to maybe take a day where I just get to putter around and do something very creative within my home.
Yeah, well, I definitely heard that you're sort of the Martha Stewart of home remodel. I remember your place down in Carlsbad, and I understand in your new place, you're doing the same kind of thing. You just like totally remade the whole place. And
love it.
Yeah, I totally agree that you don't work a day in your life if it's aligned with your passion.
And you don't just have to have one passion. That's the other thing too, is you can have many. It sounds like you're doing all these different things with your music and AI and your business and all of that. I think it keeps us young, that just continuing to kind of expand what our brain is doing, right? I don't want to keep doing the same thing. I'm probably really good at what I do, to be honest with you, because I have muscle memory doing it. Yeah. I don't even know if I'm smart anymore. I'm just like, I've been doing this for so long that I'm good at it. But it is a piece of muscle memory. So maybe at this point, to stretch my brain, I should do something very different so I can keep my brain active.
Yeah, I think it's really important to have more than just the career, so to speak. your future gig while you're performing at your current gig, you know, just because you can weed out a lot of the failures that are going to by definition happen, but also it helps you find that passion point, you know, those passion points. You know, I look at my father passed recently, and I'm going to do a whole cast on this because there's so many stories I could tell on this one. He was in the same law firm for over 60 plus years, and he went of counsel a few years back, and I could tell he was starting to kind of decline, and then literally left his firm at the end of last year. Not to be cliche, but then his spouse died like a month, 2 months later, and he died a month after that. And so it just like his whole life was just that. He didn't have the hobby and the interdisciplinary interests, because when the career comes down, the chief money-making avenue comes down, you need to have other things, but just to keep you alive.
Yeah.
You know, a reason to get out of bed every morning. And when I hear it, and I look up at the ceiling and I just bite my tongue when all our friends, oh, I'm retired. It just drives me nuts. It's like, no, you're not retiring. You're finding a new act. Go act 2 or act 3, but don't, you know, you're not just quitting, because you'll see that demise.
Right.
You know,
I think the friends that we have, they're retiring and going on to live very fun travel lives and all of that. I mean, everybody that I know that's retired, they go on to do all this traveling and everything else. So I don't think but I agree with you. And I think men are very susceptible if they retire and no longer have their job, because I think friendships with men are a little bit harder to just have and keep and maintain. I could see, like, I would hate for Tom to retire and he's young, but I don't know what he would do.
how many years younger?
So he's 3 years younger than I am.
It's like,
I mean, come on, though. It's like starting at our age is like, I'm going to hit 60 way before he does. I don't mind him being younger. Can take care of my ass.
Yeah. You travel a huge amount, right? Like, do you see retirement as something that you'd want to retire?
So I have no desire to travel right now, which is like, I just really, and I told Tom this because our company shuts down for the 4th of July holiday. And I'm like, I don't want to go anywhere. I don't want to look at another Marriott lobby. I don't want to get on a plane. We're actually going to put the 2 dogs in an RV and go to Idlewild and just be quiet, just be with each other with the dogs and Idlewild. I don't know what this is going to do for us, but I didn't want to get on a plane. And so right now, like you say that, and I would travel some, probably if I got a break, but I don't know. I want to be gone for maybe 5 days. And at the end of the 5 days, I'm like, I want my own bed. I want to be back home. Yeah. I like the routine of my life right now. But that's not for everybody either. Some people love the freedom of just travel and go off.
You know, grass is greener, I think. A lot of folks who don't travel throughout their career think that's just wonderful to do it. And you know, Kirsten's like doing these cruises, wanting to go throughout the world. I mean, I used to do a ton. I didn't cruises, but I traveled all around where pharma is, which, as you know, is just sort of this around the earth, you know, and kind of hit all these major countries. And your business travel is way different than the fun travel, but it's still, you get a chance to look at the cities and towns, and you know, I have no interest in going to museums or anything like that. So I'm fine staying at home. I travel. I literally flew 1 million air miles on United. So it's like, I don't have interest in travel. Yeah. And those who have this desire to do stuff they hadn't done in their careers, I get that, but that's kind of short-lived. I think in a few years they might actually say, you know, it's time to get a new job. But that's where I think it's wrong. I can't judge people right or wrong, but it's time to find a new passion. Yeah. And that's why I say it's great to try to find passions while you are currently living a money-making job. It's the best time to do it. So
I think I just came to that realization because one day I was thinking, I'm just going to quit. I'm just going to give myself the freedom to quit and go pick something else. More so just because I thought it sounded fun to just jump off and do something crazy and just quit. I'm a little spontaneous in how I do things. Once I decide I'm going to sell my house on Strata, I sold my house on Strata. But yeah, I am starting to see that. Don't quit, Christy. Keep the job you love and do the other stuff on the side.
There's so much to be said for it because the money-making element is a key point. You want to have enough money where you're comfortable and enjoying your life, but that can't be the only reason. And you know, to my father's point, he ran out of money. I mean, he completely financially decimated.
Dang.
First time I'm saying this, obviously, in the podcast, but it's like to the point where like even his assets, reverse mortgages, money was pulled out of a couple of his houses. And while he traveled a lot, his spouse was an airline stewardess, so they could fly anywhere in the world. And he didn't have to fly private. He literally flew first class on American Airlines anywhere on the planet. And he made an error of buying multiple homes in different locations. And that's a home, multiple homes, kind of like boats. They're instead of boat is a hole in the water with which you pour money down. Homes are a hole in the earth for which you pour money down.
Yeah. Unless you can enjoy them for a significant part of your year, why would you have one?
Exactly. And so, you did the math. I used to think, I want to buy a second home in Sedona and just go there. But you know what? Just go there every few months if you want and stay in a nice resort. And you do that for 10, 20, 30 years. It's still much less money than if you were to actually go buy a property there.
Yeah.
Unless you buy properties that generate income, there's no reason for doing it.
I can see there's times where it probably pays off to do that while you get to enjoy it, though. Don't do it just, I don't know, for me, do it as an investment.
Unfortunately, real estate just takes so long to grow. We saw some spurts here in California, and you were here at a time where you came in a little bit higher, but we came in earlier in a big spurt. And every time a new school was built, it was increasing value, and there were multiple schools built.
Yeah.
And we also had a rare occurrence. I was in Silicon Valley during the time of .com, and where people were buying houses in cash and going way over asking price, and so there was a big pop there. But most real estate, it's maybe capture and rent money, but it's not a great financial investment unless you're somehow are renting out, and even that's sometimes not very lucrative. So they're much better
I think
vehicles.
that's lucrative if you bought 30 years ago and your mortgage is over, right?
Yeah.
Or like what you and Kirsten did. I mean, I think everybody that bought into Strata and has it taken out all their seconds and all of that, I think are sitting pretty in a much different financial situation than somebody that just bought into California 3 years ago again.
Well, that's exactly right. But, I still carry a mortgage. I mean, it was healthy to have a mortgage years ago when you had a good deduction, but that's
Right.
gotten pruned down.
Now that's gone.
Yeah, but realistically, you really never own your home because you still have property tax. And after the gains that they've seen in the market here, when you sell it, even if you're still married, you have this capital gains deduction that's only so large. And so you're going to wallop taxes. And most importantly, it's not liquid. Unless you pull like quick home equity loans out. There are times where people need a lot of cash quickly, and you can't just say, I'm going to go sell my house. And sometimes when you're in that situation, you don't get the best value. I don't really, and I think there have been a number of studies in this, I don't think homes are great financial vehicle investments compared to the spectrum of other vehicles. It's important to have them, I think, but it's unfortunately the whole U.S. population, the primary net worth position is their primary residence. And I think that's a bit of a liability to them. So I think when people talk about retirement, the notion of losing purpose is so troubling to me because, I've just literally seen it. I saw it with my father, quickly demise. My grandparents, they retired very early and they didn't live very long. My mom retired fairly early and she didn't live very long. And it's just there's a strong correlation, at least what I've seen in the world of my view.
Yeah.
So.
Yeah, I don't ever really talk about, I joke around about retirement, but I don't really ever, people are like, when are you going to retire? I said, I think when I die. I think that's financially what I've decided now. I'm not kidding.
Yeah.
I don't see myself, it could be good or bad, but my identity is very wrapped up in what I do.
Yeah.
I have other passions. I'm very identified with the work I do.
So, we got to wrap up, I think, soon. Did we say 6 or 6:30 today?
I think you said 6.
Okay, well, fortunately, Kirsten and maybe
Hopefully,
Tom, they'll be down
Tom
there.
has to pick me up, actually.
Oh, does he?
Yeah.
Is he picking up here?
I think so.
Oh, did
yeah.
he drop you off here?
Uh-huh.
Oh, okay. Well, anyway, so when you think about your future gig that you're planning, is there anything you want to announce at this point? Or are you
No.
still formulating ideas?
Yeah, because if I announce what I'm doing, people think it's so probably boring or it's funny what probably turns me on that other people are like, I hate doing that. I'm like, well, that's why it's a turn on for me. So yeah, it's all going to be around the home stuff. But just different niches. So.
Well, I hope you're not thinking, I don't want to disclose it because someone else might take it. Because then non-disclosure, like I'm not telling you stuff.
Oh no,
Yeah.
No, I'm seriously not disclosing it because you'll think it's boring and you'll make fun of me. Yeah.
That's how you bulletproof stuff. You kind of visualize it with other people before
Right.
you do it. So what is it? Go ahead, tell me.
Well, on it, so it's just around the home stuff.
Yeah.
So I do actually want to, and I'm almost afraid to say it, but be like a master organizer of kind of not just your home, but kind of lifestyle too. So I love making things beautiful for other people. And I've done a couple jobs that brought me pure joy. I would love to spend time just shopping for other people to make their home beautiful. And I'm really good at spatial stuff. So people can put a whole room together and they have no concept of scale. So like what couch and what chairs and what table would be on scales. I can just walk into a room and tell you exactly what it should look like from a scale perspective. Not that I do it perfectly in my house because sentimental stuff comes in and all of that, but that's one. So my brain works just in an organized manner. And I've done it for my kids where I look at a pantry. I'm like, how are you living like this? This is ridiculous. And she's like, we have 5 things of flour. I'm like, yeah, you're wasting a lot of money doing this. So as a gift, I just said, I'm going to redo your whole entire pantry. And I loved it from beginning to end, just from the time I went in to measure, listen to her and how they live and how they want to do it, to the ordering off of Amazon and container and all the other stuff, to installing it and doing the whole job. It sounds so boring, but to me, like I could get so excited
It's not
about
boring.
it.
I totally see a market for that.
There's a huge market. I am not the first to think of it, because when you go on TikTok or Instagram, it's like these people have been doing it for a long time. But I think what people aren't doing is shopping for others. And I've done that for a friend. I'm like, okay, I'm going to send you 3 couches. Tell me which one you like the best. I'm going to send you 2 tables. Tell me which one you like the
They
best.
arrive at Amazon, they got to send 2 back.
So they pick one, and I do everything off of Wayfair. Right now, I could do it off of any site, but so I just created, she lives in a multi-million-dollar home and her house looked like shit. And so I'm like, I'm going to redo your living room. How much do you want to spend? She told me. And so it's kind of like, I never want to say designer because it's certainly not, I'm no designer, but I could, and people that are busy and working, they don't have time to go on Wayfair and all the other websites that you can go and buy furniture, because there's a million of them out there, and find exactly, it took me hours to do. And I loved every second. That's the difference. Most people want to do that, and about 10 minutes later, they're like, I don't want to find a couch anymore. I'll just keep this one.
So functional organization with design, like Johnny Ives at Apple was crazy good at that, right? And you might have that sort of natural eye for it too, but I think it's great. I mean, definitely, I would love to put this as like your hook. This is what Christy Shearer wants to be when she grows up.
You would love it. Well, and honestly, we live in an area that is probably time for it, because we live in an affluent area with people that don't have tons of time, or honestly, just design or knowledge or style, any of that, right? So I could help a lot of people, or people have just been living in their own clutter for a long time.
Yeah.
And I think it's a helpful thing, but I am a firm believer in you should live in beauty.
Yeah.
I think whatever your beauty is, I do feel like if you never invited one person over your house, it doesn't matter. It should be like you should live in your own beauty, and whether that's outside, inside, whatever. And I think every drawer and door you open should be beautiful inside too.
Well, that's great. I love it. And so I'm expecting that you'll make significant progress in the years ahead, or months,
Maybe.
however soon. I'm sure there's some stuff you could design in here. But functional design is what I'm big on function.
Yep.
But if you put beauty on that, it's just like
Yeah.
powerful. So
In fact, that's a funny thing, because there's so many like just the most simple examples. There's so many cords everywhere. And like, how do you make that pretty, right? That you have all this stuff. And I've just been like looking at different things. I'm like, oh, you can make that really pretty.
Well, look, you look at this place, you're probably like horrified. But this is kind of thing where people come in and they plug in and they drop and run. And so a functional element needs to be to deal with that. It's not like just one person or 2 that are living in a house. This is just like musicians. They just drop and run. So I don't know if you have some thoughts we should chat about. I'd love to find a way to make it look better, but it still needs to be very functional. So
yeah, no, I think
you're looking at like, no.
No, I think you've done you've done a great job, because you could tell you're organized here.
Oh, it's still a mess, but yeah.
It looks,
but I cover up the mess. That's it. Yeah, underneath the rug. You're like, don't want to look underneath that. You open the drawer, you see people do that. Oh no, look at that drawer.
Yeah, no, I think it looks good in here. It looks very functional, functionally organized. Yeah.